All right, team. Welcome back to Plastic Surgery Untold, Beyond Botox and Butts. I'm Dr. Johnny Franco, also known as Austin Plastic Surgeon. We got our celebrity cast joining us again. Today we're talking tummy tucks, which is one of the most popular procedures in America right now. And before we get to the good stuff, let's catch up what's going on with our celebrity crew here. I want to bring up a little nugget that actually happened to us a couple weeks because he will keep this from you guys. So I am letting celebrities moment here of what he's done, but I want to make sure that people know the real story of what he's done. We were at Austin Smiles Gala, so shout out to them, and maybe we can have them, if celebrity allow it, on the podcast one of these days to talk about all the great things they do. It's actually
absolutely.
Actually, as some of you guys know, and feel free to jump in. You guys are all participants of it. Austin Smiles is actually a group started here in Austin by plastic surgeons that raises money and actually goes on mission trips to help kids with facial, hand, burn deformities, anything that kind of the plastic surgery community can help. And then many CRNAs and anesthesiologists have gone on trips to help, and so go to various parts around the world and help do this. So great cause, Austin Smiles. Feel free to look them up, donate, participate. They're always looking for people to help. But as part of that, they had a very small gathering. They did mostly a virtual gathering. And one of the board members came up to me, and I was trying to introduce G. Berto, Austin's most beautiful man. I was like, "Oh, this is my friend G. Berto, Austin's most beautiful man." And she goes, "Oh, how could I forget him? He's so handsome." I was like, "Wow, boom, okay, you're welcome, G. Berto."
Yeah, she made me blush a little.
Yeah, so this is all fact.
This is fact. Yes, this happened indeed.
And she hadn't seen you in over a year.
It'd been over a year since.
And still just remembered you as the handsome man.
I guess I'm just that memorable.
Oh my god!
And then
It's gonna be a long episode.
And then I was there with nobody said anything about me.
No, they didn't.
I thought that's where you're going with it.
Always leave him smiling, John. Always leave him smiling.
Yeah, I didn't even get an invite to this. So
yeah, it was a much condensed list, and some people made the cut, some people didn't.
Oh
Boom,
god.
boom, boom.
Okay.
Life right now, 2020, got to make some tough choices.
Cutthroat in here.
Celebrity, what's going on with you? Catch us up. Big house moves, big life moves, been all sorts of things going on in your world.
Yeah, house moves, life moves, rehabbing the knee. I think I told you guys last time I finally did sign up for a half marathon, so that training will start in 2 weeks. I'm excited about that. It'll be at the end of February, and it's going to be in Zion National Park in Utah.
Nice.
So that should be exciting. Gilberto, there's room for one more if you want to hop on.
Maybe.
Yeah,
I haven't run a race in a couple of years,
well,
but
maybe we should do it, man. Maybe we should do it and get Franco. We can put him in a wagon and just drag him behind us.
That's what I'm talking about.
Wow.
That's what I'm talking about.
like those moms on the trail with the baby strollers.
That's exactly right. But
I'm
big old baby
I'm gonna be
stroller.
doing that with little baby Winston. Little baby Winston will be strolling in his stroller. I'll be running around Town Lake with him. So
There we go.
If anybody wants to give me a Christmas present, doggy stroller would be much appreciated.
Perfect.
I like the little angled ones. Some nice padding because I don't want him to get hurt.
Terrible.
Donald, what's going on with you?
Oh, man.
That sounds great. Moving on. So today
you see this?
No,
You
please,
see,
Donald. Please.
you see what I'm dealing with?
No, please catch us up.
No, man. I've been pretty busy. I do a lot of stuff in the gaming world, and it's a lot of business
You
kicking up.
say this. Can you tell us what you're doing in the gaming world right now? Because I feel like plastic surgery is a black box to all of our listeners.
Yeah.
The gaming world, other than like Call of Duty or Halo, or Madden, 2020 is a black box to me.
No, there's a lot going on, and like the funny thing is with
Such
everybody
as?
being home. Well, I can't speak particularly to the projects that I'm doing because I'm signed under NDAs.
Uh-huh.
But what I will say,
of course.
what I will say is, working
We'd
on.
like to talk to the people about tummy tucks, but we got an NDA.
No, well, hey.
So this is going to be the world's shortest podcast.
Unbelievable.
I'm sorry to all the listeners that wasted some valuable space on their iPhone downloading this
It
podcast.
depends on how many of these listeners are even into games, but No, that's what I've been up to, man. It's just making games. It's a lot of people at home staying home playing games, so a lot of games need to be made.
Gotta ask. 3 favorite games quickly of all time.
Battlefield, anyone from the Battlefield series, Legend of Zelda, Breath of the Wild, and then Mario, just for old time's sake.
All right. Spoken like a true gamer, he knew immediately his top 3 games.
Oh yeah,
I'm glad you helped him because he had a lot of airtime there and really said nothing. And so we heard NDA, we had I can't tell you any secrets, and so boom, boom, boom.
I gotta ask real quick. Can you get me a PS5?
I possibly could. Actually.
What?
Yeah.
All right. We gotta talk after.
Oh yeah. Now I'm important. Yeah, there it is.
Well, let's jump into this. Let's talk tummy tucks, because this is a cool topic, and we've talked a little bit about them as part of mommy makeover, some drainless type stuff, and why we do that. Today, let's just talk overall tummy tuck and kind of techniques, options, and what we can or can't do. And why don't we start with who's a good candidate?
Yeah, that's a great
I
question.
love
Who is
it.
a good
Yeah.
candidate, Dr. Franco?
Boom, boom, boom. Typically not Austin's most handsome man, but you never know. Some men do get tummy tucks.
That is very
Uh,
true.
I think it's a hard call, because people want to avoid the incision, the scar. Most people would rather do liposuction if they can. So really comes down to a skin issue. And so, a lot of people come in and they're, it's funny because I'd say probably half of our tummy tucks are people who initially came in for a BBL lipo and just weren't good candidates for that. And then we're just better candidates for a tummy tuck. Kind of the rule of thumb is if you got a significant skin issue, i.e. extra skin, loose skin, you've lost a lot of weight, pregnancy, other stuff, then you're going to have need a tummy tuck in terms of that. One of the most common complaints we get when people come in for a tummy tuck is just they had babies, had a C-section, they got skin that folds over that kind of tummy line, panty line, and they've worked out, they've done other health lifestyle stuff. Because you can lose weight and do that stuff with good lifestyle changes and working out, but it's sometimes hard to treat the skin issue because some of that's genetics, and it just depends how much that skin will retract over time.
So what you're saying is a tummy tuck is not a weight loss procedure?
I think that's an incredible statement, because we do a poll on our Instagram all the time when we take the skin out, how much it's going to weigh. People will say 20, 30, 40, 50 pounds. And then, unfortunately, I think a little, surprised, maybe even disappointed that it typically weighs a couple pounds.
2 pounds, 3 pounds,
3. A
1.5.
huge tummy tuck is 7 pounds,
Yeah.
maybe. So the vast majority of people, and I think the point you're getting to is that you really want to be as close to your ideal weight before the tummy tuck. The tummy tuck's not going to get you to that ideal weight.
Interesting.
Completely agree with that. Also, BMI.
Yeah, and so everybody has some different BMI cutoffs. We've recently changed our BMI cutoff to 33. The lower the BMI, the less risk of complications. And no question, at 35, you see a steep jump in terms of BMI, in terms of complications, and some of that just has to do with a lot of factors. If your BMI goes up, people are at higher risk for hypertension, diabetes, other underlying medical issues that are kind of a sequela of that. Also, just tends to be more tissue. So that's all the medical reasons. The second part is the higher your BMI, the less results you're going to see from it.
Absolutely.
Because most people see us do the internal corset, the tightening of the muscles, but we have internal and external fat, and we can get to this when we talk about men and tummy tucks in a little bit. But we can do a lot to treat the external fat, so the stuff above, outside of the muscles, in terms of liposuction, tummy tuck, fat removal, different things like that. But tightening the muscles is limited by what it's going over. If you think about it, it's just like trying to close you overstuff your suitcase and you're trying to zip it closed. If there's just too much on the inside, there's just a limit to how much you're going to get that compressed and down. Same thing when we're tightening the muscles.
Interesting.
Completely agree with that. And I think, before I really got into plastics and doing plastics cases routinely, I had this complete misconception of what a tummy tuck was. I thought that you just chop off a big portion of fat that you have around your midsection and you're done. You just sew it up and you're all finished. But there are tons of different techniques. There are also, skin-only abdominoplasties. There are abdominoplasties where, you're repositioning the opening for the belly button. I didn't understand what happens with the belly button. So I'm hoping we can kind of get to the bottom of a few of these things before we're done today.
Let's start from the beginning, because like we talked about, typically someone who's getting a tummy tuck is someone who's not a good candidate for liposuction.
Sure.
And so you got loose skin, whether it's stretch marks, whether it's skin hanging down. And that's because, not to digress too much, but so we can put in context, when we liposuction somebody, we're taking that fat out, but then we're dependent on that skin to shrink down and give them that shape. If you already have loose skin that's not tight, we can take out more fat, but you're still going to have loose skin. And then, so you're not going to have that hourglass figure. So the idea is that we're taking out that skin and we're reshaping them. Sometimes it's in combination with liposuction. A lot of times with a tummy tuck, you'll see us do, liposuction back and flanks, maybe a little fat transfer to the butt hips, do a little 3D sculpting, and then finish it off with a tummy tuck, because now we've thinned out that waistline, and we can get rid of the skin and kind of really cinch people in and make that look good. And so that's, I think, some of the stuff you're talking about. It's not just cutting out some skin, putting it back together.
Sure.
There's a lot of cool internal, sculpting stuff we do to give people that nice V angle, give them that little internal corset, and get them shaped just perfectly.
One of the things I wanted to ask you about is, like, we were talking about who is a good candidate for a tummy tuck. What are some of the things that these candidates can do before they get a tummy tuck? Obviously, they want to get their BMI down. You're talking about the internal corset where we are, suturing the muscles together. Are there certain exercises that they should be doing to help with those things and to kind of help speed them through recovery?
I mean, I think a little bit, and I think a little beyond the podcast here in terms of specific workout routines and exercises. But I think, to your point, I always tell people the better shape you are going into the surgery, the better you're going to come out, because it's a physical stress on the body. No matter what celebrity and I do during the surgery, there's still some physical stress on you during it. So, and maybe it's some of the points you're alluding to is, 1, getting your weight down, 2, eating healthy. I tell people, don't make big changes right the week before the surgery. By then it's too late. Do you? But, the more you can kind of clean up your diet, eating healthy, because all those things have long-term sequelae, right? So, it's funny how many patients we see that have, because this is a big portion of our tummy tuck population, is people who've had some type of bariatric procedure.
Mm-hmm.
And just with the weight loss of the 50, 70 pounds, how many people tell you that I used to have hypertension, I used to be pre-diabetic, I used to have this, and with loss of that weight, all those things have gone away and just kind of resolved on their own. And so, that's obviously one extreme, but no question, working out, eating healthy, not smoking. Smoking is another huge one that they have 100% control of. And just like breast reductions on our previous podcast, a month before, month after, that's a deal breaker. You come in, you're smoking, you got cigarettes in your pocket. Unfortunately, I've talked in our office about this because we've done it with COVID a little bit, is you do the walk of shame out of the surgery center. So, back to G. Berto's college days where he did the walk of shame out of the sorority houses at 6 in the morning. You're doing the same at 7 in the morning out of the surgery center with your little surgical bag, because you didn't have surgery, because you were still smoking up to the day up. COVID, unfortunately, is still an issue, and here in Texas we've had spikes. So have tried to warn people, leading up to your surgery, be crazy about being good, wearing masks, using hand sanitizer. And I'm not trying to get political, just from a medical standpoint, the things that you would do to prevent getting the flu, that you'd be from getting strep, from getting other things, you have to do it, because from a pure medical standpoint, myself, if celebrity sees you, if his nurses at the surgery center check your temperature, you wouldn't go under an elective surgery with a fever, not feeling well, with any type of sickness, because the chances are that you're going to have a problem have gone up exponentially.
Absolutely.
Celebrity?
Here in the biz, we call that a cancelectomy. We don't like to see that because, we don't want to cancel cases. We're there. We've got the team there. Dr. Franco's there. Everybody's there in place. We're ready to do those cases and to get those patients treated and taken care of.
And we understand it's a big portion of your life. They've taken a lot of time. So it's heartbreak for us when we have to do this.
It is. And we want everybody to have the best result possible and to be as safe as possible. And if we're doing anything to not promote that, we're not doing our jobs. So, we screen everybody as soon as they do get to the surgery center. I know Dr. Franco is having his patients tested. It's one of those things where we're doing everything we possibly can to make sure that it's as safe as possible.
Did that kind of answer your question, Donald? I feel like you opened up Pandora's box.
Yeah, I did.
Sorry,
definitely.
we even went down the COVID rabbit hole on that one.
But I think some of those things were super important for people to understand, because most people have waited a while for this surgery, have jumped through a lot of hoops in terms of doing the things to get themselves ready, and it truly is heartbreak. But I do also want people to understand, if we didn't care, we wouldn't do it. We wouldn't send you home.
Totally.
Right.
It's true. Easier for us to just do the surgery and be done. But it's not how celebrity rolls.
Is there more than one way to do an abdominoplasty or tummy tuck? Are there like different variations to the procedure?
I mean, I don't want to be attacked by PETA, but there's more than one way to skin a cat. There is, and so kind of depends on the individual situation. One of the things, and let's start kind of at one spectrum and work our way up to the other. One of the questions I probably get at least once a day in our office hours is I want a mini tummy tuck. And so, the question is, number one, What does a mini mean?
Subjective.
So mini truly means this, that you're not moving the belly button per se. So you're keeping your belly button. Okay. And so, this is plus or minus. Some people still tighten the muscles all the way up to the chest. Other people do not tighten the muscles as part of a mini, and that's something to ask your surgeon. Again, not right or wrong, but just different methods of doing this. Second, is that because you're keeping your belly button where it is, we do something if you are tying the muscles where you say you're floating the belly button. So you lift the whole skin up in unison, keeping the belly button completely attached to the skin, not kind of around it like you've seen us do before. And so we tie the muscles, but you got to put the belly button back down in an exact spot. Because you're going to look really weird if we pull that belly button all the way down and you got your belly button holding your belt up. And so, got to put it down. And the reason I'm making such a hard point about that is that means that when we pull the skin, if the belly button's going down into the exact same spot, we can't take any skin above the belly button to pull that down. So if you got loose skin above the belly button, a mini's not going to help you. It helps those that just have a diastasis rectus where the muscle is really loose, and we're going to tighten all that and maybe take a little bit of skin. Very few people don't have a little bit of skin. Also, if people are very, very, very select few people that just have some loose skin, either above a C-section scar, below the belly button, everything above the belly button looks phenomenal. Those are good mini tummy tuck candidates. A mini tummy tuck is going to be a little longer than a C-section scar, not quite as long as a full, because remember, the length of the scar is directly proportionate to the amount of skin that we take. And
Sure.
I think that's super important because the more skin we take, the longer the scar, because it's going to go further. Typically, we're going higher, and it's going more around the belt line area. Does that kind of make sense? Because I think that's super important. Sometimes people have a misconception that a mini is like less than a C-section scar. It's not.
Yeah.
And it's hard because everybody wants a short scar stuff, but you also want a good result.
Yep.
Yeah.
And I think it's a fine balance with some of that. And so I'll tell you, in our practice when we were together, Gilberto, I don't know if you've ever even did a mini with me.
I don't think we ever did a mini together.
Because we probably at my practice,
It's-
and we do about 500-600 surgeries a year. I would be surprised if we do more than 3 or 4 minis a year.
Yeah, I would agree with that. I did one just the other day with one of the other really good guys in town, and it was just the perfect patient for a mini tummy tuck. The patient just had some loose skin right above her C-section scar, and it was just right there. She was in phenomenal shape. Her BMI was probably 18. She looked like she had washboard abs just with some extra skin. She had a little bit of diastasis that we ended up plicating, or the surgeon ended up plicating just below the belly button. And
I thought maybe you scrubbed in, threw a few knots in there.
No, but to your point, the people that qualify or that are good candidates for that mini abdominoplasty.
Because what would you say if for tummy tucks you see maybe 1 out of 10, 1 out of 20?
Oh, probably
is a mini?
1 out of 20.
Yeah,
if not
yeah.
less.
Because the problem is if you get a mini and then you're not happy, there's a really significant amount of time that has to go by before you can revise this. Because again, trying to protect that belly button, and it always comes back in plastic surgery blood supply, making sure that belly button's going to heal well. And so now you got to weather the storm for a while. And plus you've gone through all the recovery.
Absolutely. You did touch on one thing a second ago that I think the listeners would probably love a little bit of expansion on. That
give the people what they
diastasis, right? That diastasis recti. What is that? And I think that is a huge part of a tummy tuck that I didn't understand before I got into plastics. So maybe you could elaborate on that a little bit.
Oh yeah, I think this is a huge part, and in our videos we call it an internal corset because we're just trying to get rid of kind of the fancy terms and make this something that people can relate to. But basically, those muscles get stretched and pushed to the side, and that's why sometimes you see people who are really fit, they don't have a lot of fat, and their belly bulges, and sometimes they come in for liposuction, and I'll push in front of the mirror and be like, hey, you see how you touch those muscles right away? That's because that's the internal stuff, and it's really kind of cool when we do a tummy tuck and we lift that skin, and you can actually see that gap between the muscles where those muscles have been pushed out, and that's pretty dramatic, and that's one of the most kind of satisfying portions of the tummy tuck is pulling those muscles back together and just relining that up.
And when you say the muscles, you're talking about those rectus muscles that are right in the middle, those 6-pack, 8-pack ab looking muscles, right?
Yeah, and if somebody's not sure exactly what we're talking about, you can go to celebrity anesthesia, and in the mornings he's usually running without a shirt. And
Every day.
you can see exactly where those muscles are, and so I think that would be a good diagram for you to be able to know where they should be in a perfectly, chiseled man.
Oh God.
But it's not just men, right? I mean, some of these muscles they
Oh
kinda
no,
separate and
he's
weaken.
got a girlish figure too. He's got some hips, those shaved legs. No, I think it's a good representation
Hey, it makes me faster.
of either sex. Good point, Gilbert. Good point. Very good.
Pregnancy can cause that a lot, or lack of exercise of the core and stuff can weaken those muscles and cause them to separate, right?
No question. Pregnancy is probably the most common,
Yeah.
but no question. Extreme weight gain, anything that simulates that can cause those to come. So it's pretty rare. I honestly can't think of the last tummy tuck, whether mini, full, whatever, that I didn't tighten the muscles, because it's so rare that somebody doesn't. Who doesn't say I want my belly flatter, my waist smaller?
Yeah.
Yeah.
I'd use mine a little flatter, a little smaller.
And once those ab muscles are pulled together, they actually function like they were supposed to function again. So a lot of women, that we do tummy tucks on, you tell me that they come back and say, I feel like I can finally do a real sit up again. I finally have that ab and core strength that I used to have pre-pregnancy.
Here's a little quiz for celebrity Donald and Gilbert.
Uh-oh.
Why do you get the 4-pack, 6-pack, 8-pack? If this is a straight line muscle, why do you get those little bulges? Why do you get those muscle bulges?
Well, the straight line is not actually the muscle. That's the linea alba
In the middle.
I was going to say that.
Right, you got the linea alba in the middle. That's good. But then you still have the broadband linear muscle going down, because that's your pulley. That's what makes you flex, just like your workout machines. So why do you get the little blocks of muscles?
I would say because they're pulling from different angles.
It's hypertrophy of the muscle from working out.
But only in a few little spots?
Well, I mean, if
You
you're only getting them in
Well,
a few
it's-
little spots because you're not working out hard enough.
I'm
No. I would think it's because of the different sections of.
What sections? Yeah, there's something called inscriptions, and those are what section them off. So there's actually a cool little fascial band. So you got the linea alba down the middle, and then so the fascia comes around and over them, but it actually enwraps that whole muscle, and that's what we use to pull these muscles together. But it's segmented in little blocks. You actually have a transverse inscription, and that's why when those muscles get bulged, you actually have a tight band that separates the little compartments of the muscles as they come down, and that's why you can see the 6 or 8 packs, as in my case.
So they're not breaking through the fascia, is what you're saying.
No.
Like when you are repairing them.
No, you don't want to open the fascia.
Okay.
The fascia is what.
Well, I'm not the doctor. I'm making sure. Yeah,
No,
I'm not going to be in there.
Please, don't break the fascia. Fascia's there for support. Thank you, Donald. Battlefield 3.
Yeah, exactly.
So little nugget there. Just next video we'll show you guys. Tune in at Austin Plastic Surgeon. I'll show you some inscriptions. Kind of cool. Just dropping some little anatomy nuggets on you guys. But moving
Always
on.
learning.
So tightening the muscle, getting to full abdominoplasty. One of the questions with a full abdominoplasty, which is where we go all the way up, typically take the skin from the belly button all the way down to the pubic line area. And then get everything into a good spot here, okay? And so the question is, a lot of times, is whether you do liposuction with a tummy tuck or not. In the vast majority, yes, we do. Because there's areas like the back flanks, and I tell people, you want to look absolutely fabulous coming and going. And so the love handles typically is an area that we don't address with a tummy tuck, because we don't want the incision to go endlessly far. We want to do what we need, but only do what we need, and then liposculpt the rest of the body so that we can get that in. There are some areas where you have to be careful in liposuction, especially kind of above the belly button in that mid-central area, because we do want that skin to heal well. Again, goes to blood supply.
Blood supply. Name of the game.
Name of the
Oxygenating
game
those
and everything.
tissues.
Got to get that stuff to heal. But I do think there's some fancy stuff we can do with the liposculpting, fat transfer, other things to really get that belly into a good spot. And I think either Travis or Austin's Most Beautiful Man brought this up earlier in terms of it's not just the removal of the skin, but a lot of times we get a little bit of hate on our Instagram about why the skin is bunched where we suture it together.
Sure.
And I think people don't realize, if you think about it, just from a pure geometry standpoint, right? There's the line on the bottom is much shorter than the big arched line on the top. And so we can just pull this down, but then you just have kind of a flat line going all the way that goes much further. You also still look really square if you just pull stuff down, right? That's not changing the shape. So if we're working really hard to tighten those muscles on the inside, then we got to do the same with the skin so we can show off all the hard work we did on the inside. So it's doing that V. So we bunch it. So we purposely V that skin in and try and bunch it in. So that way you get that nice curve and little silhouette, much like Gilberto. You know what I'm talking about?
I do know what you're talking about. I used to help you with some of these cases.
Exactly. And we used to do our little tricks where we just kind of push, mark, and that way we can get that in and get that nice, perfect shape. So the skin does bunch out, but just sort of like we had talked about on a previous episode, it's pretty amazing how that stuff just smooths out over time, and you can do some of these little plastic surgery magic tricks to make everything look just perfect.
Absolutely.
So we talked about the mini tummy tuck. A little bit on the full. Is there any other?
I feel like we've been talking a lot.
Well, is there any other ones that we haven't talked about?
There is some other ones in terms of this, and most of them are just, it's all spectrum. So, the mini, then the traditional are full, then some people, of course, do with or without lipo. So those, if we can be semantic about it, tend to be broken up as well. And then there's things like a circumferential body lift or, 360, and that's where the incision goes all the way around. Some people will do what's called like an extended tummy tuck. I don't get too much into that with our patients. It kind of goes where it needs to go, but extended would be kind of going around towards the back, but maybe not all the way around. People who need a 360 or circumferential, tend to be someone who's lost over 100 pounds and just have excess skin all the way around. So,
Sure.
those are definitely options. A lot of the portions stay the same. You're still tightening the muscles, still limiting. Typically, if you're doing a circumferential, probably very limited liposuction in those areas as you are making a lot of incisions. And typically their issue is just a skin issue and not a fat removal issue in terms of that. There's some more, again, focusing more on terms of stuff like massive weight loss, something we like to call a fleur de lis. Tummy tuck.
Get a little
again,
French action.
Yeah, no, and it's something that I don't think is used all that often, but again, sort of like mini, it has its time and place, and I know I think you've done one or two with us, a celebrity, and I know a few other docs at the surgery center do them occasionally. Again, just in the right person.
Yep, exactly. It's patient dependent, and definitely Google it. It's a fascinating procedure, and the way that the incisions go and everything kind of comes together is not your traditional tummy tuck. Again, reserved for a special patient population.
Because the fleur de lis, just for those of you that don't want to Google it and want to stay on the podcast, which we would appreciate, it has a vertical addition that goes up down the midline towards the belly button. So we do some less undermining, but also helps, sort of like we're doing the internal corset, bring that in, because there's a limit sometimes to how much we can cheat that skin in to give the shape, and sometimes we need to do some things like that. There are some other fancier, or not fancier, but new or different variations of that where they don't do the vertical right down the midline and they do them on the side. And I think some of those semantics are a little beyond this podcast, but there are other ways to treat if you just have a massive amount of weight and depending on your specific situation.
One of the things I found really fascinating, Dr. Franco, is how with your full abdominoplasties, you don't have any drains. In my training, I remember assisting some of the plastic surgeons, and they used to use a lot of drains for the abdominoplasties. How do you get around that?
Yeah, we do something called progressive tension sutures, and not something popularized or created by me. Actually, a father-son combo in Dallas actually came up with this idea, and it's really worked very, 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 very well. And see, the idea is that people think that there's just a fluid buildup because of a tummy tuck. Our body naturally makes this fluid because that's how we distribute the nutrients throughout the body. So what we're doing is we're reclosing off that skin and putting it back into space so that the body can absorb that fluid like it normally would. And that's the idea. I tell people, think about your driveway. If you did a good job and it's perfectly smooth, the water and the rain just run off and doesn't collect and everything. It's there, but it just gets managed. If you got a big old pothole, then that fluid collects. And if we don't do something to get that skin down or reattach, it's not able to handle that extra fluid, and then you get what's called either a seroma or hematoma or something else where you get a fluid collection, and then that has to be drained. So there's no right or wrong method. The reason that I do it is I'm a big proponent, as you've heard Celebrity and I talk about this, of early ambulation and getting people moving.
Yeah.
And so anything that hurts is going to keep people from moving.
Sure.
So without the drains, people tend to move a little bit more because they don't hurt. They don't have something that they're carrying around. And the goal is to prevent problems. And so that's why I love it. I think people have this false idea that it makes a massive difference in terms of the way they look. Celebrity Gilbert, correct me if I'm wrong, but I honestly don't think unless you can find the drain hole spot, there's not a real visible difference 6 months from now in someone that had a no drain tummy tuck or a drain. It's truly for those first couple weeks of getting people moving and being more comfortable.
Yeah, I would agree. It's hard to sometimes even see your little liposuction ports.
Sure.
Mm-hmm.
I agree with that too. I think the biggest thing is patient comfort. You don't. Most patients do not want a drain coming out of them because now they're walking around with some foreign body sticking out of their side. And again, drains aren't a bad thing. And if they need to be put in, and because sometimes we do put in drains, we'll do it for some breast cases, even some tummy tuck cases end up with a drain. Because again, if that patient was not coagulating quite as well as we wanted to, or had a little bit of excess fluid or bleeding, sometimes we have to put one in to prevent the development of a hematoma long term. But for the most part, I would say 99% of your tummy tucks are drainless at this point. Would you say that?
Oh yeah, at least.
Yeah.
But to your point, if you need a drain, you need a drain.
Exactly.
I think in the past, the old plastic surgery teachings, everybody got one, and now we're being a little bit more selective. If somebody needs it, they need it. If they don't, they don't. And it's just part of the whole protocol of how can we improve, patient outcome, but also patient comfort. How can we get people moving? How can we get them out of narcotics? What are we doing that's causing that pain? What can we do to decrease it? If we need to do something, we will. But if we don't, and we're just doing it out of habit, let's get rid of it.
Absolutely.
And I think that's a big change in all of medicine. It's hard to teach. What's the old saying? It's hard to teach an old dog new tricks. And so I think medicine is slowly transitioning. And some of it, you don't want to be too cowboyish about it. You want to make sure there's good evidence-based medicine on it. But we also want to keep moving forward and trying to find a happy balance.
That's one thing that I love about healthcare right now is, I feel like people are actually challenging the status quo and questioning, like, why are we using a drain on every single patient? Like, I was told that in training, but what's the evidence show? Why are we doing this? We need to be able to substantiate these claims and the reason that we're doing things. Like for me in anesthesia, why is every patient coming in? Why am I giving them 250 mics of fentanyl and 2 Dilaudid for every single case? There's got to be a better way to do it that's more patient-centered and evidence-based. And I think that's how we're all constantly trying to improve our areas of practice. Just like Gilberto talked about going to a class for filler and where he's depositing and looking at it exactly with a cadaver, because always trying to constantly improve our services and what we do on a daily basis just helps with the patient's their level of satisfaction in our results.
I mean, do you think it's actually possible for Gilberto to get any better at injectables?
Actually, that's a good question. He probably not.
I mean, who knows? Who knows?
He's teaching the classes.
That's right.
That's the next step, Donald.
Other things I want to talk about, because the big question is incisions, and where that's going to be, because I think people who follow us on Instagram or social media, TikTok, LinkedIn, anything, osteoplastic surgeon, we'll see that sometimes we'll do things, because I want the incision to be as low as possible so that you can still, my goal is to get you back into a 2-piece if that's what you want to do. If you want to wear one piece, wear one piece. If you don't want to wear a bikini, don't wear a bikini. But I want you to be able to have the choice to do whatever you want to do. And so trying to get that incision as low as possible so people aren't self-conscious about it. So that's one. And people say, oh, that's easy. But the challenge becomes and Celebrity brought this up earlier, is the belly button. Because if you're taking that skin out from above the belly button, it may or may not reach all the way down to that incision. So sometimes you'll see a tiny little line or a little teeth from that incision, and that's the opening from the belly button. Because remember, it's still your belly button. We cut around it and then pull that skin down. But if that skin doesn't reach all the way, where we made that opening to release the belly button, we just got to close that back up. So I hope that makes sense for people. Sometimes why we have a T, sometimes why we have to do some different things, but it's all in unison of trying to get the scar hidden as much as possible.
And then once you pull that skin down and you have their old belly button underneath that stomach that you've now pulled tight, right? How do you pull that belly button through a new opening?
I think that goes to one of the arts of plastic surgery, right? Because belly button, I feel like, is the telltale sign of different plastic surgeons and their tummy tuck. And you can almost like tell a tummy tuck from one person to the other based on the belly button, because a lot of the parts, like we've said this many times, and I wholeheartedly believe this. It's not just the party line. I think there's a lot of incredibly talented plastic surgeons in Austin. I think for the population of Austin, I don't know if they realize how lucky they are in terms of the medical physicians as a whole, for the size of the city and the subspecialists and the specialists that are available in this city. It's absolutely amazing. My aunt is coming here in 2 weeks to have a heart procedure done all the way from West Texas. And so it's just amazing the access to such specialized medical care in Austin, and plastic surgery is not missed out on that, even outside of just aesthetics. We're talking microsurgeons, transgender,
Sure.
other stuff that's available here. And hopefully we can get them on the cast soon.
Yeah.
Yeah, that'd be great.
Thank you, celebrity. That's a punt to you.
I'll come on, people.
But the way I do it, and there's a bunch of different ways, is I actually like to create this little flap, because my goal is, I think, the perfectly round belly button. None of us have a round belly button, and there's actually a great study that maybe we'll talk about. Maybe Celebrity and I, or Gilberto and I, can talk about this study that showed the ideal belly button. And they basically, I wish I had thought about this. I would have loved to have done this study for my internship. They basically went to a bunch of colleges and took pictures of belly buttons of these female co-eds, and then showed people and said, "What's your favorite belly button?" And that's how they came up with the ideal belly button. So I would have loved to have been the intern on this
Franco's
study.
dream
I
job.
know.
Anything for science,
Here
right?
I am, working with mice and in a lab, and somebody's taking pictures of college students' belly buttons. I was like, I missed out.
All in the name of science. All in the name of science.
Somebody had to do it.
I'm just doing research. But so I love to create this little flap, because we can pull the belly button down, and I actually cut the belly button short so that it pulls the skin down, because I want the incision scar to be below the level of the skin so that you only see the normal skin on the outside. Also, by not making it a perfect circle, it actually breaks up the lines to the eyes, and so you don't see the incisions as much. It's funny because I don't think people realize our eyes are basically a bunch of light beams that fill in the gap, and if you can break that up, it's less obvious to our eyes and brain. And so it's some of the reason that we do Z-plasties and other things that break up perfect lines so that the eyes have a harder time seeing it.
Interesting.
Little nugget. For you guys.
Dropping nugs today,
Look
man.
at this. He's like a little artist over here.
You're welcome. You're welcome.
Jeez.
But there's lots of great ways to do it, and lots of people have different some diamonds I've seen people cut, some lines to keep it very thin and then pull it down. There's sometimes you can do some tacking sutures on the inside to pull that skin down. So to Giber's point, there's a lot of different roads to success here, but most people have a few tricks or nuggets to really do some nice things, and we do spend some time on it because I think it's super important.
You do the upside down V or whatever.
Yeah, it's a U. Thanks for watching.
Upside down or whatever. Yeah.
Hey,
so it's
V,
upside
U.
U. I cut out a V, pull
an
it
N.
down short. Defat a diamond on the inside, so that way it takes defat some of that up to scarpas, because above scarpas is a different blood supply than below. Just some more anatomy nuggets for you guys. You're welcome. What other questions about tummy tucks can I answer as we're down the home stretch here?
Just about recovery. It's
Ooh,
just like,
boom! That's a good one. Thank you, Donald. Great
Well,
segue there.
that's what I
Damn.
do.
I think recovery is a big one, especially in tummy tucks. I tell people, you do too much too fast, you get yourself into trouble. And I can't stress that enough. Got to have somebody to help you. Got to have somebody that's going to take care of you, because moms and farmers want to do too much too fast. Life goes on, and they're just not used to letting somebody else help them. So got to let people help you. Just put in a little bit of time in those first 2 weeks of letting yourself recover, staying in a flex position. It's not like the old days that I want you in bed for 2 weeks. We actually stress that you get up and walk the night of, but giving yourself a chance to recover is huge. I typically tell people, if you can give yourself 3 weeks to recover, I think that's ideal. It's changed a little bit with the work from home. So I think working from home and a laptop, stuff like that, 2 weeks is super reasonable. But again, we've talked about it. If you're in celebrity can touch on this, but if you're on narcotics, if you're on any type of things like that, shouldn't be making any important decisions.
Yeah, absolutely. I always tell people, don't make an important decision within 24 hours of getting a general anesthetic. I normally say, don't change your will or sign any legal documents within 24 hours of general. But also,
it's so funny that Mary tried to get you to change some stuff.
Damn.
Right after your surgery, and it's just like when you got your calf implant, she's like, "Hey, change
like,
this will."
Sign this life insurance policy. No, not quite. The other thing I was going to talk about is what we kind of do during the procedure
Ooh,
and,
yeah.
and post-op, or to set people up for a good post-op course. And I know we touched on it last time in our podcast, and
You
I
mean when
kind
you
of
said,
teased.
okay, there's no spoiler alert, but then you said, I'm going to tell you exactly what it is, which is exactly a spoiler?
Yeah. So
Okay, just
alert, I just spoiled it. We may or may not be getting an ultrasound. And what's nice about that ultrasound is it allows me to see through the skin, basically to have almost a X-ray vision, if you think about it like that, and allows me to put a small needle and go in and place local anesthetic in a perfect little area that is going to bathe those nerve roots that innervate or give signal to that area, your brain's signal to feeling in that area. What we try to do is develop this local band of anesthesia basically around your midsection, which we do through what's called a TAP block, which is a transverse abdominis plane block. And we can use a large amount of local anesthetic to fill that space up. And what it does is we use one of the long-acting local anesthetics you've heard us talk about on here a few times, Exparel, and we'll mix that with a little bit of shorter-acting local anesthetic so it starts working a little bit faster during the case and immediately post-op. And then hopefully that Exparel, if it's placed properly and if it degrades over time like it should, we should get up to about 24 to 72 hours of local anesthetic relief in that area. And again, what we're trying to do is just make patients more comfortable without having the side effects of taking all those narcotics.
And I think these are all the little nuggets that people don't realize, the extra steps, right?
Yeah.
The Exparel, the blocking of these muscles. I think Exparel has been a dramatic jump forward.
Completely agree.
I don't know if we were already using Exparel when you and I were working together, Gberto.
We were, yeah.
Because before that, and Celebrity probably remembers this, we had the pain pumps,
Sure.
which are great, but the problem was they were a little user catheter dependent.
Yep.
And because they were made to be these tiny little catheters, if they got pulled out, there was no way to put them back in. If they got clogged, whatever, right? And then
Yep.
also too, they were just laid on top of the muscle. There wasn't a way to get deep down into the nerves that you're talking about like we can now with the Exparel. So they helped, but I don't think to the same degree, because the key of these nerve blocks is getting right next to them.
And that's one thing that's huge about Exparel, and you've heard me talk about it in the past. It's that bupivacaine molecule that's inside of a little liposome. So it slowly degrades over time, but it doesn't travel through tissue like normal local anesthetic does. So for me and Dr. Franco, we have to be basically right next to that nerve in that little neurovascular sheath to develop or to deposit that local anesthetic right along it. So it ends up slowly breaking down those liposomes and delivering that local anesthetic over time.
And we don't want to give people the wrong idea. You're still gonna be sore.
Oh yeah,
You're still gonna know you had surgery.
Yeah.
But all these things have made a worlds of difference from the old days, and this is why
Absolutely.
you can get up and walk that night of and
Yep.
do some of those things.
And I always tell patients too, if you're a 10 out of 10 pain wise, my goal is to get you to a 5 out of 10. If you're a 7, I want to try to get you to a 3 or a 4. We're working to go in the right direction. I cannot make you pain free. That is just not something that's ever going to be on the table after you have any type of surgery. I don't care how good your surgeon is or how good the anesthesia is. You will never feel like you do walking through the door to have surgery.
The last thing I want to touch base on, just because I think it's super important, tummy tucks, some of the things we worry about are DVT, blood clots, and that's
Yep.
why we stress and all these things that we're doing to get people walking and moving faster. Some cool things that one of our surgery centers does, and then we've incorporated into our practice, is sending people home with compression devices, the actual compression devices that you have during surgery. Technology's just gotten better. It used to be these big machines you had to attach up. They were at the foot of the bed. Just wasn't practical. Now you have these tiny little battery powered, things that you can put on. You wrap around the legs, and they basically squeeze the calves when you're on couches. Again, not a replacement for getting up and walking, but again, just all the extra things to make sure that we're being super safe and decreasing some of these things that we worry about. The other thing we've started is a different blood thinner that we start on the day after. It used to be that patients had to give themselves shots and some other things that were a little bit harder. I don't want to give myself a shot. Just not the most fun things in the world. And technology, pharmaceuticals have gotten better, and some of this has made the recovery easier for patients and safer too.
Totally agree.
Anything else to take us home before we do a little behind the bovie?
I think I kind of rounded it out.
Yeah,
Yeah.
that was it.
Any behind the bovie nuggets anybody would like to share?
I thought the one you said earlier about the actual weight of the tissue not being as much as people think. I can't stress it enough. It's not a weight loss procedure. You're taking care of skin. You're tightening that skin. You're tightening those abs back together. That's the real true beauty of a tummy tuck.
I agree. Not a weight loss procedure. I think one of the other cool things is we always say tightening the muscles, but to somebody mentioned earlier, the fascia, the strong covering around the muscle, that's what actually holds it. And we actually try to purposely grab just the fascia and not the muscles, because the muscles what causes pain, and bringing that together. So we say suturing the muscles together, but we're actually using that strong covering around the muscles to bring them together and hold them into a good spot. And then sometimes people ask us about that suture we use. It's actually a suture that dissolves over the next 6 to 9 months, because truly after 2 or 3 months, once those things have completely scarred in, the sutures aren't really helping much. At that point, the body's healed and it's just, scarred in and set. To go back and take out those sutures, isn't going to make any difference. And so just letting them dissolve so that there's no foreign bodies on the inside.
I think one of the things that's kind of interesting is how you position the patient when you're bringing the skin together. And
That's a good one.
And
That's
you
a good one.
sit them up in a kind of flexed position to suture the skin, and they kind of leave almost kind of hunched over a little bit, and gradually over time, as the skin stretches, they can become a little bit more erect.
Yeah, no, I like that. It's called a Fowler position. Anybody know what the original Fowler position? So for those that want to use medical terms, it's called beach chair. So to go, we're saying knees up, bent over a little bit.
Yep.
Fowler position. Celebrity, you're not old enough to ever have had to do the Fowler position for something. Anybody? This is a really nerd kind of nugget.
It's above my head.
I don't know, man.
Well, why don't we come back to it on the next podcast?
All right.
Leave a little nugget, because it has nothing to do with plastic surgery. Was used probably been 50, 70 years since we used this treatment, but Fowler position came from an initial method to treat something else. I'll leave you with that nugget. In fact, no, actually, let's do a little quote of the day.
Let's do some quote of the day.
I've got one.
Oh, perfect.
If you want it.
Yeah,
okay.
please.
This is from Helmut Schmidt, and it says, "The biggest room in the world is room for improvement." There you go. I thought that was topical, because we're talking about improving patient outcomes, doing things in a better way, in a very conscious way, and thinking about why we're doing things the way that we're doing them, and challenging the status quo, and looking for evidence-based practice to back up our practice changes.
Cool. I know. I like it. I feel like Gilberto is the shining example of this.
Oh,
I think there's always room
100%.
for
Always room.
always room for improvement.
Well, I want to thank everybody for listening to the greatest podcast in the world, as voted by us, Plastic Surgery Untold, Beyond Botox and Butts. Thanks to all of our guests for joining us, for dropping some knowledge today. So appreciate it. Don't forget to follow us on your favorite channels. We're available on iHeart, wherever you get your favorite podcast. Plastic Surgery Untold. Thanks, you guys. See you soon. Bye.
See you guys.
Boom.